Hi, my name is Matt, and I'm an occupational therapist that currently works at Highbury Hospital. I'm based in the Maples department, and we cover the inpatient adult mental health wards. I joined the rotation April this year, so this is my first journey on a rotation for the Trust.
Hello, my name's Mariam. I'm an occupational therapist currently working in the mental health services of older people. I work on the inpatient wards and in the community in people's homes. I work closely with a lot of older adults struggling with their mental health conditions, including depression, anxiety, things like dementia as well.
So I'm Jodie, I'm an OT. I work in a low secure forensic unit on a adult male rehabilitation ward for males with mental illness. Our role here is about supporting them to achieve their occupational goals and support their recovery and rehabilitation into the community.
Hello, my name is Lola. I work in adult mental health as an occupational therapist, supporting people in the community, to access the community and live well with mental health.
I guess I accidentally discovered OT. I was 21 and working in the prison service, and at that time there wasn't much progression in my role, so I started looking for other jobs that suited me, and I came across a job as a patient activity nurse working in a forensic hospital. I had no idea what it was, but it sounded interesting. I remember the job description described it as delivering activities as part of the occupational therapy department. So I did some research and found nothing about what a patient activity nurse does. So I researched OT and found all different definitions of this role. I was interested by how varied it was, so I applied for the job, went for a visit, and loved it. Thankfully, I got the job and was honestly one of the most rewarding and fun jobs that I've ever had. Whilst there, I discovered OT in different areas and settings and decided that OT was what I wanted to do. I've not looked back since.
I discovered occupational therapy through my mum. She works in the community with physiotherapists and occupational therapists. I'd never heard of occupational therapy, so I spent time shadowing her team and was really inspired by the work that they do. And also just how much they supported service users staying in their homes and staying independent.
When I was a teenager, one of my close friends at school, her mother had a diagnosis of multiple sclerosis, and she had a lot of input from OT that I was able to witness in terms of building up her independence with her ADL skills, and also looking at adaptations and equipment that was provided to her property. And it just really enabled me to see the difference that OT can make, because I saw how she was before she had that OT input, and then saw the difference that having that input made to what she was able to do and her overall quality of life. So it really enabled me, really allowed me to think this is something I'm really interested in. So then I went away and researched more about it, and found that it's such a massive area, which also drew me to OT in terms of the scope of where you could, the different areas that you can work, and just the difference that you really get to make to people's lives to live independently.
In my previous jobs, I was an occupational therapy assistant in stroke and in forensics.
I first joined the Trust in 2013, working as a patient activity nurse at the Wells Road Centre, where I delivered therapeutic activities planned for by the OTs. I did this role for 3 years before taking the plunge and making steps to study OT. But because I'd been out of education for so long, I needed to complete an access course to get onto the OT course, so I completed this alongside my working role. I then went to study OT at the University of Derby, where alongside this study, I worked in various OT support worker positions. I worked as a wellbeing worker, recovery college teaching assistant, and a sports instructor for the OT team at the Wells Road Centre. I did this for my first year of study before securing a permanent position working part-time as a sports instructor for the Maples OT team at Highbury Hospital following my second year placement with them. I qualified as an OT in June 2019, where I secured my first OT job working on the physical rotation at QMC. I started as an OT working on medicine and surgery, but due to COVID, rotations were stopped, so instead of the 6 months, I worked with this team for a whole year. I really enjoyed this role, and I learned so many essential OT skills, but I really missed working in mental health. So when I saw the OT mental health rotation post come up, I had to apply, and thankfully, I got the job.
I've previously worked in the private sector in lots of rehabilitation units. I spent time setting up my own department, helping my service users to get back to the community and building a positive life for themselves.
So my career journey so far, my plan throughout my training and when I applied to do OT had always been to work in mental health. I'd done a placement when I was training, and I just really loved the work that we were doing with the patients you were able to work with during that time. I really felt like I was able to make a difference to their lives, and it was very individualized, and you really felt like you were working quite closely with the person. So that had always been my plan. When I qualified, I struggled to find a mental health role. So being very keen to start working as an OT, I applied for a physical health role, and kind of got stuck down that path a little bit. So I've done many jobs within acute physical services and social services throughout the 10 years that I've been qualified. But I got to a point where I was thinking, I really want to pursue what I'd always wanted to do in terms of working in mental health. So I decided to have a look at the opportunities that was out there to get a position and finally get a position in mental health, and was fortunate that I was able to do so.
When I worked in forensics, I just decided that, I wanted to study occupational therapy. When I saw, just how occupational therapists really help people. So I went to study occupational therapy, and especially then through my placements at university, just knew that I wanted to work in mental health, and especially with Nottinghamshire Trust, because it is a mental health trust. So far I've worked in mental health services for older people and adult mental health, and in both acute and community settings.
I really enjoy how diverse my role is and how every day is different. Every service user is an individual, so I'm constantly learning, adapting, and supporting people in whatever way they occupationally need it. And that's what I like the most, working with people and helping them achieve occupational performance in what's important to them.
I am a people person, so I love to meet new people from different walks of life and being a guiding hand to help them achieve their goals. I enjoy working in collaboration with other professionals in my team, learning about their roles and how important we are all to each other and to the patient. Within mental health services, everyone is different, and it can be an exciting challenge and an opportunity to get creative with the work that I do.
So there's so much that I could say about what I like about my role here. I think I really feel like it's very individualized to the person that I'm working with. It's so collaborative. You're working on their goals. You come up with them together and support them with what they feel they want to achieve. And it's very occupationally focused as well, which is brilliant. So you really feel like you're using your core OT skills and core OT philosophy within this role to make a difference to their lives and support them with being independent within the community, whatever that means to the patient that you're working with.
I really enjoy being an occupational therapist because it's nice to be part of people's recovery journey, and it's really nice to promote opportunities to achieve any sort of daily goals and personal life goals. and helping people live well with mental health problems.
I chose a rotation as it's the best opportunity to become the most holistic and well-rounded OT. You get to experience OT in different areas, from adult inpatient to forensics to community and older adults. There are so many transferable skills to learn that will increase my knowledge and my confidence, but will ultimately benefit service users.
I chose the rotation as it offers experience in different areas of mental health, and it's a chance to work on developing and enhancing my skills. It's an exciting opportunity to meet different people in different teams, occupational therapists with a lot more experience than myself, and a great chance to learn from the best.
So having done many physical health roles, and that being my background previously, I saw the rotation advertised and it really appealed to me. I'd done a physical health rotation and I know from experience the benefit of doing a rotation in terms of building up your knowledge within that clinical area and building up those skills and transferable skills across each area of the rotation. So I knew it was going to be really brilliant in terms of developing my mental health skills, having not worked in a mental health role throughout the previous time in my career. I thought it was an excellent opportunity for me to be able to develop those skills and learn from the different areas that I'll be working in. It's an amazing opportunity to get to see different clinical areas as opposed to a static post. Sometimes it's been quite difficult to know what area you want to work in. And so that's the beauty of rotation, getting to see different teams, different specialities, really enables you to actually see what you would like to do. And sometimes that surprises you. It did when I did my physical health rotation. So that I think that's a really excellent positive of doing a rotational role.
I especially like the rotation that Nottinghamshire Trust offers because it's really varied. You know, you can work within adults' mental health and older people's mental health service, and also it's for a year long. So compared to physical health, where it is 6 months, it's nice that you have a long time within each team or each service to learn the service. And you know, I've really enjoyed working within the trust, and I've really enjoyed the rotation, especially. It just gives you a broad range of skills as well, transferable skills that you can use within each setting, and it has really given me confidence in my role as an occupational therapist.